Prisha and I'm with the Orchid organization. I go to the Middlesex County Academy for Allied Health and Biomedical Sciences, and I'm passionate about dental health. So I'm going to start off with a few questions. Has anyone here ever had to get a breath mint because their breath smelled really bad? Or have you ever had a really long visit to the dentist's office because there was so much plaque for them to remove? Well, I'm going to take a guess and say that most of us, when we go to the dentist, we listen to what they have to say and maybe follow it for like a week, but then we forget about it and don't do it anymore. So this may or may not have been you, but I'm here to talk about the importance of oral hygiene, and I'm going to talk about some tips that could help you keep your teeth clean and healthy. So does anybody know the definition of oral hygiene? Okay. So oral hygiene is the practice of keeping your teeth, mouth, and gums clean and healthy to prevent disease. So I want to go over a few terms. So first is plaque, and plaque is a sticky film that coats your teeth and it's covered with bacteria. And gum disease happens when bacterial plaque builds up on your teeth, and if left untreated, it could lead to irreversible damage to your jawbone and other support structures, and it could even lead to tooth loss. And some symptoms of gum disease are when your gums are red, swollen, or tender. So why is oral hygiene important? First would be because it helps prevent things like bad breath, tooth decay, and gum disease, and it also helps you keep your teeth as you grow older. And another reason would be that healthy teeth enable you to speak and eat properly. And last, problems in your mouth can have a huge effect on the rest of your body. This is because your mouth is filled with harmless bacteria, and usually with proper oral hygiene like daily brushing and flossing, you can keep the bacteria under control. But sometimes when you don't follow the proper oral hygiene, then the bacteria, they start growing out of control and they reach levels that could lead to infections in your mouth. So when this happens, it's a really big problem because your mouth is the entry point to your digestive and respiratory tracts. So then the bacteria from your mouth can enter your bloodstream and cause infections throughout different parts of your body. So these are some examples. Pneumonia happens when the bacteria in your mouth is pulled into your lungs. And heart attacks could happen because the bacteria travel around in the bloodstream and they release a protein that causes the blood to thicken. And when that happens, clots are more likely to form, and that prevents your heart from getting the nutrients and oxygen that it needs, leading to an increased chance of getting a heart attack. And last, diabetes and gum disease. They have sort of a two-way relationship. This is because, first, if you have diabetes, then the high blood sugar levels, they provide an ideal environment for the bacteria to breed. And second, because the inflammation in your mouth that's caused by the gum disease, it could impair the body's ability to utilize insulin and therefore weaken the body's ability to control blood sugar levels. But fortunately, controlling one can help control the other. So what can you do to keep your teeth clean? First, you should brush twice a day with a soft bristled brush and a fluoride toothpaste that is approved by the American Dental Association. You should also floss daily, and that is to remove food particles that are stuck between your teeth and under your gum line. You should also eat a balanced diet, and you should avoid snacks between meals and also avoid foods with added sugars. And rinse with mouthwash, obviously, to get rid of food particles that may still be present in your mouth after you have brushed and flossed. And you should also replace your toothbrush every 3 to 4 months, and that could even happen earlier if the brushes are frayed, because a toothbrush that's worn won't do the effective job of cleaning your teeth. And lastly, make sure to schedule regular dental checkups and cleanings. So when do you know that you've achieved good oral hygiene? That would be when your mouth looks and smells healthy. And that means that your teeth are clean, they're free of debris, your gums are pink, and they don't bleed or they don't hurt when you touch them, when you floss, when you brush. And also, bad breath is not a constant problem. So, the next time you feel like you want to skip your after-dinner brushing or flossing, remember the things that you've learned about how big of an effect your mouth has on the rest of your body, and use some of the tips that I talk about to keep your teeth clean and healthy. So does anybody have any questions?
Yes, I do have a question. So how many times do you need to brush your teeth?
You need to brush daily. I mean,
How
two
many
times a day.
2 times?
Yes.
Is it before a meal or after?
It should be after your 2 big meals of the day, which are probably breakfast and dinner.
Okay, alright.
Why don't you need to brush during lunch? Like, what if I eat a big lunch?
Well, usually this presentation is directed to kids, and we're at school, so I don't really see how you could brush during school. But obviously, if you're an adult at home, then you should brush 3 times a day. That's even better. These are just the ideal requirements for kids.
How about floss?
You floss daily, and that's at the end of the day, because that's when all the food particles are stuck in your mouth, so you try to get rid of them. And you also have to get rid of the particles that are under your gum line and between each tooth.
I noticed you didn't mention anything about mouthwash. Why is that? Do you think that mouthwash covers up your bad oral hygiene, or is it an effective solution?
Oh no, it is actually really effective. I had it on the previous slide. So you should use mouthwash after you brush and floss to get rid of any food particles that still are left over in your mouth. So it is actually very effective.
So what is the sequence of brushing, flossing, and mouth washing? What is the sequence?
So the sequence is first brush, then floss, then mouthwash.